Hi, I'm Dr. Brian Hollett, Chief Medical Officer at Shift. I was fortunate to have grown up around primary care medicine in the 80s and 90s, to have had the unique opportunity to get the glimpse into what primary care has looked like historically, to then be more attuned to what we need to seek to restore, to continue to elevate primary care to the level that it can and should be. One thing I'd love all new patients to know is that when it comes to your health, we want to be, myself and our entire team at Shift, an expert co-pilot for you in this journey of your health. So as we aim to continue to deliver proactive and meaningful insights to address both the current and future issues in your health in a way that aligns with both your health and life goals, we need you to be an engaged pilot with us. As the co-pilot, we want to feed you with the insights, but it'll be up to you to action upon those insights. So we were really looking for someone who's ready to roll up their sleeves and get to work building and sustaining their health. When first meeting with a member, the goal is to deliver care in a casual and relational way, yet delivered to a standard of exacting excellence. Similar to the quote from Will Durant, "We are what we repeatedly do. Excellence, therefore, is not an act, but a habit." Building our health must be a habit. So rather than approaching someone thinking about building health in a sprint mindset of saying, what can I do for the next 60, 90, 180 days? The approach that we take is asking, how can we weave a heightened routine of health into the fabric of your life so that it becomes core to who you are? It's not just something that you do, it's part of the routine that you live your life with. When thinking about healthcare, I think it's really important to break apart our conceptual framework for it into two halves. There's the traditional aspect of healthcare, which is the combating disease side of things. The second element is building health. This is where, rather than asking how do we avoid the ailments from taking hold, we ask how can we optimize our health, thinking through that much in the same way that we would think of optimizing any other finite asset in our life. So at Shift, we very much center in and say, when it comes to somebody's health, the more experts from different domains that we can have looking at and assessing somebody's health, the better the level of insights that we'll be able to create to take action to help someone to build and sustain their health. So it's the blessing that as the physician, I can say that I am an expert, but I don't have to be the only expert involved in someone's care. And that enables each member of the team to be able to truly play in their domain of strength. Who are you? Where are you at? What are your routines? And what are your goals? Because we acknowledge that goals are so very important to determine what is meaningful in somebody's life. We want to get to know an individual as our entire team, get to know what matters to them, and then let us be the wind behind their sails, driving them forward towards those meaningful elements in their health, both in the short term and in the long term. The thing that keeps me energized and resilient in medicine is that medicine is my passion, my calling, my profession, also my hobby. It is the thing that deeply nourishes me. How do I help people to live better, longer?